So hi and welcome. This is Dr. Charley Ferrer and you are live with Dr. Charley, and my special guest today is Colette Saucier, who is a wonderful author and is actually going to be talking to us a little bit about her work, as well as providing some questions from individuals and some readers and fans of hers who had questions for me on sex, love, life, relationships, and everything in between. As you may already know, if you have any questions for me, please go to my website and email me at drcharley@drcharley.com. That's DOCTORCHARLEY at drcharley.com. Again, all spelled out. And you can always call and drop us a line and let us know what's going on. I want to say hi to Colette. Colette, this is our second time together. Isn't it great?
Yeah. I'm very happy to be here.
I'm great. It's like, okay, I'm waiting for you to say, no, I don't want to be here. Make me stop.
Okay, no, I don't want to be here. Please. You're going to have to beat me and just
I will tie you to your chair. Isn't that what I did? Didn't I tie you to your chair?
Oh, I wish.
Yeah, because if for those of you that don't know, Colette gets a little shy when she's on the air, and so getting her to talk and such is sometimes fun to do, and teasing her. But for those of you that don't know, Colette actually writes romance novels and talks about different relationship issues, and your new novel just got nominated for Romance Novel of 2013, Alicia's Possession. Is that correct?
Actually, well, it was nominated, and I appreciate being nominated. That was a huge surprise because it was so long ago. I forgot I even had a novel that came out in 2013, but it actually was voted in the PNA Readers Poll as a top 10 romance novel of 2013.
Isn't that awesome? Isn't it great when they acknowledge your work? I just love that. When somebody
really
turns
is.
around and does it. Because there's so many books out there.
Yes, it really is. It has gotten reviews, excellent reviews, and that's nice. In fact, I was surprised by the reviews, but because I thought this other book I wrote was a lot better. But I've been very happy with the reviews. But to have the readers themselves vote for it and to select it as a top 10 romance novel of 2013, that was a shock, and I'm just thrilled about that. And
I'm very happy. We'll have to have cocktails again when we meet in New York.
I'm looking forward to it.
Yeah, so we'll definitely have one then. And another wonderful thing about the book is that it actually has some bondage in it, a little bit of dominance and submission in it as well, doesn't it?
It does, and you can never go wrong with a little bit of bondage. Even for the most vanilla couples, I recommend throwing a little bondage here and there. But I do hate the way that the media depicts dominance and submission and everything in this negative light. And I'll be glad when it's not like that. And
I will be glad when it's not like that as well. There is a lot of discrimination, a lot of misinterpretation of what goes on, a lot of misrepresentation as well. And part of what I do with educating people on alternative lifestyles is the fact that providing them with actual information, providing them with the facts instead of what the media gives.
Right. Well, and before we got started, I will tell our audience that we were talking about Amsterdam because I go there frequently, and the Dutch had this study, gotta love the Dutch, that actually found out that people who practice BDSM are mentally healthier than those who do not. And yet, when you watch these television shows or these movies, whenever you've got somebody who's into S&M or whatever, that's going to be the bad guy. He's going to be psycho or whatever.
Yeah, it's kind of like the old movies where everybody that dressed in black, you knew they were the bad guy, and all the good guys dressed in white.
Right.
So it just kind of, you know, puts you in the mindset of this must be it. And, you know, and one of the points that the study that you mentioned, the big point of it is that with individuals that are in the lifestyle, in the BDSM lifestyle, they're actually experiencing their entire scope of sexuality, or for the most part, at least 70–80% of their scope of sexuality. They're practicing it and enjoying it with their partner, whereas individuals that are known as the vanilla world, those that do not practice dominance and submission, those individuals tend to have more problems because of the fact that they get very repressed on their sexuality, and they're not allowed to express it, or they don't feel comfortable expressing it. And so that's where the problems come in. That's where the infidelity comes in. That's where you have individuals that will start fighting their nature and then behave in inappropriate ways. It's kind of like the straight man who makes fun of homosexual men. You know, a lot of the times I think that for those who are very adamant against homosexuality and actually pick fights or are inappropriate, it's because they're struggling with their own masculinity, and therefore they have to do something wrong.
And politicians and people in the church and everything, the ones that shout the loudest against homosexuality, they're the ones that end up being homosexual.
Yeah.
It's like, I think they do protest too much. It's definitely true. But those that are willing to accept their own sexuality and find partners that are aligned with that, they're the ones that are able to connect with their true selves better than anyone else.
Right, and the beauty of it is that with the new DSM-5, they've taken dominance and submission out of the mental health scope of it being abnormal and being something that's wrong with you. Whereas, and for those individuals who don't know what a DSM-5 is, a diagnostic to statistical manual. It's the manual that we use when we're diagnosing someone for psychiatric conditions. And so they've actually taken BS out, and basically what they've done is that they stated that this is a condition of individuals who are consensual. And I want to make sure that people understand. It's consensual, not unconsensual, but consensual DS is considered a way of life, and it's considered to be a condition or a paraphilia that does not have any kind of medical necessity for treatment. Whereas if you think back about 30 years, homosexuality, being gay or lesbian, was considered a mental illness, and now it's off the books completely. And so what they've done with DS is that they've taken it from it being some type of an abnormal condition to a condition not in need of treatment. As long as a person doesn't suffer from major anxiety or major conditions and problems with accepting themselves. And the piece that I talk about on that aspect is the fact that a lot of individuals do feel uncomfortable and have anxiety about their sexual desires, about, you know, spanking their partner or being tied up and such. And it's okay to have a little bit of anxiety when you start having major anxiety, or when you start having any kind of sexual dysfunction, like inability to be orgasmic, or if you're having impotency issues. That's where you need to talk to someone, and finding a kink-friendly therapist is so important. And I tell people, you know, for therapists, if you're a therapist, make sure you note it on your on your information on your website or whatever that you are kink friendly, because there's so many therapists out there that are still very judgmental and very, what I consider inappropriate with their patients, telling their patients that because they participate in these activities, there's something wrong with them and they need treatment or they need some type of psychiatric care. And it's more of those individuals, those therapists do not know what DS is all about. And so part of what I do in my educational endeavors is to teach therapists how to understand this lifestyle. And it's also part of why I put together BDSM Writers Con, because it's not only for writers, it's for everyone who's interested in this lifestyle and wants a little more information. And so as opposed to the BDSM conferences out there where you're going and you're playing and you're learning more because you're in the lifestyle, this BDSM Writers Con is your step in. It's like the entryway to other activities where it gives you information, it gives you the basics, it gives you advanced, it lets you see live demonstrations. There's what we have over 40 workshops, so over 40 hours of education. And there's two tracks. There's one track for the writers, and there's another track for readers and fans who are interested in getting information about dominance and submission, that they're getting curious about the novels and they want more. And so BDSM Writers Con, and it should be BDSM Writers and Readers Con, is your step into the lifestyle where you can get comfortable, get to know some of the basics, and then from there, it's your jumping spot to go and play in other places and to go to other events. And part of it, too, is, we talked about the fact that there's so much misrepresentation of the lifestyle out there, especially media and so on. But a lot of the culprits as well are writers who haven't done their research, who haven't educated themselves in the BDSM lifestyle, and they're writing these books and they don't know what they're talking about. They figure, oh, well, if I have them tied up, that's a great theme that makes my book a DS novel, and actually it doesn't. And so part of it is educating the writers and saying this is what you need to know, and respecting this lifestyle, because that's so important. This isn't just a pretend. This is an actual lifestyle that you are presenting in your book. And the other piece that I try to remind writers is the fact that, sometimes you as the writer are introducing your reader to this lifestyle for the very first time. And you become the judge and the jury on whether or not there's something wrong with them. Because if you portray all your characters who participate in this as being sick or mentally ill, or they must have had some kind of trauma in their childhood, excuse me, and that's why they're doing this, then that's what your reader is going to believe. And if they identify with these desires, they're going to think, oh, well, it must be something wrong with me. And let me see, did I have childhood trauma and that's why I want this? Or I'm still waiting for the man that I'm going to love or the woman that I'm going to love forever. So once they're here, I'm cured. And that, as a writer, I think it's your responsibility to be able to portray a lifestyle appropriately and with respect.
And that's what I've been trying to do, because I've got, I must admit, I'm addicted to police procedurals and all those, like Law and Order and everything. Mm-hmm. But I think the thing that pushed me over the edge was the following. And I love the following, but when you have a scene and you say, oh, well, he's at the BDSM club, and you know that he's going to be the bad guy. And mm-hmm. That's just so obnoxious. And yeah. I'm sorry, I'm gonna do some nepotism and do a shout out to my daughter. She's in New York City, and she is directing her first off-Broadway production called Felt Left Out, which is about homosexuality. It's kind of a drama parody of Sesame Street. It's all about Bert and Ernie as a gay couple right after Stonewall, and it's something that she's doing, and I'm extremely proud that she is doing this play, and that I even raised my children in an environment where they felt like homosexuality was a normal thing. For example, my other daughter, the one that's not doing this, she ended up taking a lesbian as her date to her senior prom, not because my daughter is a lesbian. My daughters are all heterosexual. However, we've got such an acceptance of homosexuality is just a reality, and that's who you are.
Yeah.
It's just normal. It's who you are. And when my daughter was going for her senior prom, she had just broken up with her boyfriend recently. She didn't feel like having to go and get a date and have some kind of expectations. And she had a friend who had already graduated who had not been allowed to bring a girl as her date to senior prom. And so she said, well, why don't you come as my date? And so the two of them went, and they were the cutest couple. They were so cute. My daughter was just gorgeous in her beautiful pink and white prom dress, and her date, this young lesbian girl, was just beautiful in her pink and white tuxedo, and they were adorable. And that's what we should embrace, that everyone can be whomever they want to be. And we should not denigrate them for that.
No, and it's kind of like saying, you know, well, we shouldn't like you because you have blonde hair, you have black hair, you whatever. I mean, we need to understand that it's the respect of the person. And I've done, you know, because I do a lot of counseling, I talk to especially, you know, young college students who are just coming out, who are talking to their families and understanding that the only thing that changes in your child is the fact that now you know their sexuality. Nothing else has changed in your child. They're still your child. They're still as bratty as they used to be or as lovable as they used to be. And the only difference is that now they're sharing with you a special part of themselves and saying, you know, I want you to love me still. I'm still your child.
Exactly.
And that's the only thing that's changed, the fact that they trusted in you. And so, you know, I've had a few students that have confided in me and come out with me and said, you know, well, I'm just practicing for the big part. And I'm going, okay, great. So, you know, so here I'm your stepping stone on helping you feel comfortable with yourself, and you're gaining the courage to go on to the others. Because I teach at different colleges, and helping students is what I love. Teaching is what I love. And so it becomes a part of understanding that, you know, DS, just like homosexuality, there's nothing wrong with it. It's just how people identify and the prejudices that are experienced once you come out. And that's the difference. Because I know when I came out in my book, and I came out in my book, BDSM, The Naked Truth, and BDSM for Writers, and said, you know, this is what I do, this is what I've been doing for years, here I'm doing education. And I had quite a few of my colleagues in the psychology field who were like, well, why would you do that? Why would you say it? How can you treat patients now when you agree to such behavior? And I go back to the fact that I'm not advocating abuse. I'm not advocating any kind of non-consensual behavior. What I am doing is saying that this is totally natural, and it is a part of who we are. And if you don't realize that, then you need to go back and look at your life and see, even from childhood, the fact that you've been in some type of a DS relationship, a dominant and submissive relationship, and a power exchange, maybe using it for a better word, of a power exchange relationship since you were born. Whether it's been, you know, parent-child, student-teacher, boss-employee, neighbors. Neighbors are in power exchanges all the time. You know, where does your neighbor park? Do they park in front of your house? Do you tell them not to? You know, those are all little pieces of power exchange. And so in our world, we're all experiencing one power exchange or another. And we show our desire and our like for people in different ways. And most of the time it's physical. And so what I tell people is, don't you remember the little boy that sat behind you and pulled your hair in kindergarten, or the, you know, or the kid that, or the girl that would punch you in the arm or call you a dweeb because she liked you and she didn't want you to know that she liked you? So these are all ways that we express ourselves from the perspective of being physical with each other and being, you know, and being more, much more primal, I guess. And as we continue to grow, this starts getting taken out of our lives, because then we're told, well, you're not supposed to be this way, you're not supposed to be that way, you have to conform to these requirements. And a lot of what happens is that we get told certain behaviors are acceptable and certain behaviors aren't. And a lot of the time, it's the DS behaviors that we're told aren't acceptable, unless, of course, it's from a heterosexual perspective with the man in charge. So, right, you know, dominant men and submissive women are okay, because in society we expect the husband to be up on top and the wife to be the subservient one who follows in his footsteps and does what he says and so on. And a lot of cultures are that way. They're structured with the male, you know, patriarchal heavy. However, you know, when you start looking at the differences on how you feel and how you want to express yourself, especially from a dominant woman's perspective, everything shifts. So now you're not only going against the norm, but you're also going against culture, you're going against society, you're going against, you know, different ethnic requirements. And so noticing that there's so much more to understanding the lifestyle and understanding how people feel and how people connect with each other is really important. And going back to the therapist perspective, if the therapist doesn't understand those connections and how they are in fact normal and maybe, you know, maybe a little anxiety provoking, but within a normal scope, if they don't understand that, then they're going to be bringing in their own judgments and their own value system, and that's where you stop being a therapist and you start being a judge and a jury. And that's why I say educating, especially for anyone in the health field or anyone that's going to be interacting, like police officers, lawyers, social workers, you know, physicians, clinicians. These are all the individuals that really need to educate themselves on what dominance and submission is all about, because you're actually dealing with people.
That's why I love my shrink. And I came out last October with National Depression Awareness Month that I do have clinical depression and I do see a shrink. And he is completely open to all of that kind of stuff. He's open to, his limitation is breaking flesh. Is that as long as there's no blood, as long as you're not like breaking skin, then you're good to go. So his acceptance of everything that I've ever told him has been wonderful, because for one thing, when you have depression, when you have clinical depression, as I do, or whatever, and I have a child who has bipolar disorder, when you have someone like that, you need a therapist who is going to understand those things and accept them and not judge you for them. And he's going to say, oh, yeah, okay, that's fine. I understand where you're coming from. And actually can help you understand why you have these needs, why you have these desires. And so...
And I would say not only understand them, but in cases where it's a consensual thing, where it's a healthy display of them, then being able to help you understand that they are in fact healthy and to get you to further educate yourself. Because I think that's the important piece. As you further educate yourself, as you start expanding your mind, then you start being able to decide for yourself, well, this is acceptable, this isn't acceptable, I like this, but only up to a certain point. And that's the piece that people don't always understand, is the fact that there are so many levels to DS. There's so many levels that people play. You mentioned before, well, it's okay as long as there isn't any blood or any skin breakage, but it depends on the level. So some individuals that experience BDSM actually play at a higher level than others. And so for them, it might be acceptable to have blood play or to, or to whip or flog to the point where somebody does have an abrasion, or if there's blood. However, again, it goes back to the fact that these individuals are doing it consensually and safely. And so, educating yourself to go to organizations that can teach you, that can help you learn further, that can help you understand how to play at certain levels. And I think that's also the other piece.
That is my own psychiatrist who was speaking directly to me and my own background. And so he might have given a different directive to someone else. But the point I'm trying to make is that he was open to any kind of lifestyle like that. And so because of that, he was open to it. And that's the way all psychiatrists and therapists should be.
They should be.
They
should be, not that they are.
I know, but especially after the study that came out that showed that people that accept their BDSM lifestyles are actually healthier mentally and psychologically than those who do not, those who pretend. And that's something that I think should be recognized by the psychology community, the community of psychologists and psychiatrists, that this is something that
some do, and unfortunately the majority don't. That's why, like I said, when I came out in my book, I did have, a lot of colleagues that faulted me for it and felt it was inappropriate. And I thought, I think it's appropriate to let people know that this is healthy, normal behavior, as long as it's consensual and as long as there's, as long as you're doing it from the intent of sharing, not the intent of harming. And so, there's a lot to it, and understanding it is important. And again, as I said, I do a lot of education on this. That's one of the reasons why we're having BDSM Writers Con, which is in August in New York City. And we have it every year, once a year. This is our third year. So awesome stuff. What I want to do is I want to move us forward a little bit, because I want to make sure that this time, because last time we got some of the questions answered, but there was a lot of questions that were asked by readers and by people sending in information. And so I want to cover some of those on this call and being able to.
And that is my fault, because in order for me to participate in these calls, because I do have a lot of anxiety, I do have to keep glasses on, and so
yeah. No, that's
I interrupt a lot. But yes, please.
No, that's fine. And I encourage whenever I have somebody. What?
Well, I said, please answer my reader's question.
Answer your reader's question. I know you've been sending me emails going, when are you going to write it out? When are you going to write it out? And I'm like, okay, let's just do another live chat.
Because they have sent me emails saying, Dr. Charley didn't answer my question.
She didn't answer my question, and she answered his. I don't know why. She likes him better than me.
Yeah.
I get that all the time, and it's one of those things where, you know, I mean, my assistant here, my partner, makes fun of me because of the fact that when I go to answer a question, I try to find as much information, or I try to give you as much information in the answer. And so one question might take 20 minutes to answer, whereas when I'm on a radio show, kind of like this too, it's less, you know, it's not as formal, but when I'm on a radio show, all they want me to do is give you 2-minute answers and get off. You know, and stop answering the question. And yet there's so much information out there. So what we're going to do is I picked all the ones that you had, and as I mentioned, the prior discussion, so those of you that are interested, when I had Paige Matthews on my show, we actually did some answers to some of the questions and some of the DS questions on there. So I'm going to start answering some of these questions so that we can get to them. And I'm going to take the first one. So this one says, I've loved my boyfriend and having sex with him, but I never have an orgasm through intercourse. I can come when I masturbate, and I can get myself off easily. I think I have had orgasms during intercourse with other boyfriends, but I'm not sure. And so in order to answer this question, I want to focus on the fact that the person can be orgasmic when they're masturbating. And so that, for me, it tells me that the person is able to be orgasmic. They're able to have pleasure in their own body. And so what's really happening here is the comfort zone, the comfort with the partner, the comfort with being sexual with another individual. And this is something that is very common, especially in women. What happens is when you're touching yourself by yourself, there's no fear of, are my breasts going to sway the wrong way? Are they going to lay flat? Do I need to hold my breath so that I can hold my stomach in, so that my partner doesn't see that I have a couple of love handles? So again, it goes back to comfort. It goes back to allowing yourself to be as open sexually as you can with your partner. The other piece that's happening too is the fear of being orgasmic in front of your partner, and therefore that keeps you from being orgasmic. It's the same issue that men get with impotency. They get afraid that they may not be able to stay erect for the amount they need, or be erect in front of their lover, and so then they become impotent. Women have the same thing. They just end up, suffering from anorgasmia, which is the inability to be orgasmic. And so allowing yourself to give yourself permission, allowing yourself to be orgasmic with your partner, and talking to your partner about what it is that you might need. Is it okay for you to scream? Is it okay for you to have them talk dirty? Is it okay for you to not worry about the clock? And I tend to call it stopwatch syndrome. A lot of women suffer from what I call stopwatch syndrome, and that means that you're watching the clock when you're having sex. Because you think, well, okay, he's been at this for a while. I should have come already. I should have climaxed. I should have reached my orgasm. And so you start watching the clock. And the more the time goes on, you start feeling uncomfortable because you haven't reached that pyramid yet. You haven't orgasmed. And so, of course, you start getting anxious And now that you're anxious, your body's not relaxing, and so it's keeping you from being orgasmic. And so the really important piece is allowing yourself to relax.
And that was one of the questions with your interview when you were talking with Paige last week, because I believe that one of the questions was, you know, I think it was something about my partner never goes down on me, blah blah blah. It was
there was one on oral
yes, and she said, oh, you know, I have to go down on him all the time, but he never wants to go down on me, blah blah blah. And when with that question, I was in the reverse, because exactly what you said. You know, when it comes to no
pun intended.
No pun intended. When it comes to oral sex, that's it. It's the clock. Because I would so much rather be the one who is the giver of oral sex than the recipient, because I'm thinking, oh my gosh, it's taking me so long, it's taking me so long, it's taking me so long. And then, of course, I've got all kinds of other things going on in my head.
And you're losing the moment. And that's one of the pieces that when I do orgasmic therapy with women, I always talk about being in the moment. Men are wonderful with this. Men can be in the moment and enjoying themselves, whereas women take themselves out of the moment, and then they start looking at the clock. Oh my gosh, I haven't come yet. Oh my gosh, what's he going to think? Oh my gosh, he's going to get upset because I have an orgasm, so let me fake it.
That is so true. Oh my God, what you're saying is
yes. And so that's what keeps you from, and then you're robbing your body of the sensation, and so your body ends up getting upset with you, and so you end up faking. And the minute that you start faking it, you're actually doing two things. You're harming two people. You're harming yourself, and you're harming your partner. And what I mean by that is the fact that you've taken your partner's ability to be a great lover for you away from them.
I know, because I think, oh, please, I hope he doesn't want to go down on me tonight. I hope he doesn't want to go down on me tonight. I hope he doesn't want to go down on me tonight. Because exactly that. Because I've got all of these other thoughts in my head.
It would be wonderful to have him do that. And wouldn't it be fantastic if I stayed in my head and felt, not stayed in my head, but stayed in my sensations? And that's the piece of being able to be orgasmic. It's staying in the sensation of your body. And so if you see yourself worrying about the clock, and one of the things, and I keep coming back to this clock, I tell the women that I work with,
you are so
turn the clock around. Turn the clock around so you can't see it, because then it becomes the piece of, instead of worrying about, you know, well, it's been 60 seconds, it's been 3 minutes, it's been 4 minutes. You know, I mean, that's the worst thing you can do to yourself, because now you're going, okay, well, I'm not doing it, what should I do? Oh, I should pretend. Instead of doing that, turn the clock around, unplug it, have it on zeros, you know, so that you can then focus on, well, where's his hand? Where's his mouth? What's his tongue doing? What are his fingers doing? How does his body feel against me? What do I need? And talking to your partner, that's the other piece on being able to be orgasmic. It's letting your partner know if they're doing it right, giving them instructions. Your partner cannot understand, that just doesn't work. What does that mean? Does that mean it feels good? Does that mean, you know, that I should continue doing this? You know, if you're not going to give him verbal signs, then do physical signs. Grab his hand, grab his hair, grab whatever body part you need and put it where you need it. So that this way you can communicate what you need them to understand. It's really imperative that you do this, not only for yourself, but for your partner, because, you know, most of us have failed Psychic Mind Reading 101. We really have. We can't read our partner's mind. And if we're not willing to talk to them, then we can't fault them for not being the type of lover that we want. So part of being orgasmic, and part of being orgasmic as you masturbate by yourself, is the fact that, wow, you don't have to worry about anything. You don't have to worry if you scream too loud or if you, or if you come or if you ejaculate. And women ejaculate as well. Women have female ejaculation, which is where you get a rush of liquid from your vagina. And so understanding that some women will stop themselves from being orgasmic because they're afraid that they're going to ejaculate with their partner and they might get embarrassed, or their partner doesn't know, or they may have experienced it before and their partner thought that they were urinating. And so if you start understanding your body and you start feeling comfortable with your body and you start communicating with your partner, you're going to be orgasmic. There's no way that you can't speak. And it's all about communication. It's all about saying what you need. And you know what? I often say, I often hear individuals that will say, well, Charlie, I'm not comfortable telling my partner what I want. I'm not comfortable, telling them that this is what I need, or putting their hands here, or putting their mouth there. You know what? Good. You're not comfortable now. No problem. Today, you try a little bit. You try explaining just a little bit. Tomorrow, it won't be as discomforting as it will be next month. And so as you do it and you talk a little bit more and a little bit more and a little bit more, you'll get to where you build that connection with your partner, where you can tell them everything and anything. And if you've gotten to the point where you say, well, I can't tell my partner everything, then is this the correct partner for you? Do you really want to go through the rest of your life not having your sexual desires met because you're not asking for them? And I want to make sure that's clear. It's the fact that it's not your partner's fault that you're not communicating. It's yours. It's you keeping yourself from communicating. And so you have to give yourself permission to be able to be as sexual as you want to be with your partner, and that does take permission. One of the pieces that I wanted to share too is on my website I have what's called 365 Days of Love and Sex Tips, and I recommend that for everyone. It's actually, you get an email a day on tips to do with yourself, with your partner, and it talks about love, it talks about relationships, it talks about sex. But the beauty of the program is I've designed it so that you start feeling comfortable and getting confidence in yourself as a sexual human being, whether you're a male or a female. You start feeling comfortable with your body. And every day I build on that comfort with you. I build on it little by little so that at the end of the year, you're going to be so comfortable with your body that you're going to be as orgasmic as you've always wanted to be. And if you're not, I'll give you back your money. So for $5, you have an entire sexuality program going for you. So if you're interested, go to my website, drcharley.com, and click on 365, and you can sign up right then and there. So, I want to
wait. Well, going back to the other question, the thing that really got to me about that was but I'm not sure.
But I'm not sure.
I think I have had orgasm during intercourse with those other boyfriends, but I'm not sure. I'm sorry, Dr. Charley, if I've had an orgasm, I sure as hell know that I have had an orgasm.
Yes, but you know what? And that goes a little bit into defining what an orgasm is. So is an orgasm for you, and here's where I throw that special piece. For you, an orgasm is where, your toes are curling and you can't move and you can't breathe and you're just flying high? Or is it where you scream? Or is it where, you get these tingling sensations in your body? Or is it that you ejaculate? Or is it that you get to where you just have to hold on to your partner super tight as you reach climax? So an orgasm is different for each person, and also the fact that an orgasm is different based on where in your body it is. because a lot of people think that an orgasm can only happen in your genitals. And thanks to Freud, Sigmund Freud, that's what he said. If you have a masturbation, if you masturbate by yourself and you have an orgasm, then you're having an inferior orgasm, or you're having a childish orgasm. And that's not true. You're just having an orgasm, period. An orgasm is an orgasm is an orgasm, and you can have them all over your body. You can be orgasmic from a kiss. You can be orgasmic from watching a show. You can be orgasmic from seeing a picture. You can be orgasmic from someone touching your neck, someone touching a part of your body, your breast, whatever. Everyone is orgasmic in their own way. And so, if she's saying, I'm not sure, then in that point, I would say, well, what does it feel like for you? Is it like the ones that you have by yourself? If they're not, if it's different, if it's lighter, it's not as intense, then what you're having is a small orgasm. And so how to make that orgasm more intense for yourself? If you're still not sure, then, kind of what you alluded to, Colette, is the fact that maybe they didn't have one because they, they don't know what it is, or they just didn't have one with that partner because they didn't allow themselves to have it. And I have it here, maybe we can do a reader's poll and people let us know, well, are you orgasmic with your partner? Are you not? And how do you know? Or do you stop yourself from being orgasmic with your partner? And if so, why? And I think that's the big piece, because a lot of the times we stop ourselves from being orgasmic because we're afraid for whatever reason, whether it's a conscious reason or a subconscious one, an unconscious one. It's understanding why. And what I recommend to people is, write yourself a letter, a body letter, and say, I'm going to be as orgasmic as I want to be. And by the way, how am I going to achieve that? And that's where you get specific. How are you going to achieve that? What is necessary for you to achieve that? And that's asking your body to respond to you. That's asking your body to say, hey, what do I need to be orgasmic? Your body will respond, allowing yourself to respond to that. And I tell people, when you're playing with the unconscious mind, when you're trying to get to the issues that you have and the ways that you sabotage yourself, talk to yourself in color. And so go out and buy different colored pens so that when you decide to write, you write the question out in one color. You can write it out in black. And then whatever color you close your eyes and grab a color, or whatever color you feel comfortable with, answer your question that way. And then allow your subconscious to come to the forefront and talk to you. And the way to do this is you have free writing, you have free flow writing, where you allow yourself to talk or write for 15 minutes or so. Writers are great at this because they start writing, and after 15 minutes, they're into their scene and they're writing away. The same thing with individuals. You can tap into your subconscious mind by just writing. Write and write and write, and it will start talking to you. And allow your subconscious mind to talk to you. As you start asking it questions, it'll respond. And this is part of what you'll learn as well in 365 Days of Love and Sex Tips on ways to tap into your subconscious so that you can experience a more fulfilling lifestyle, a more fulfilling love and sex life with your partner and with yourself. So you don't have to be in a relationship. One of the things that I love, and Van Sant, one of the ladies would talk about how in the meantime, what are you going to do? So if you're not in a relationship, well, in the meantime, what are you going to work on yourself so that when the relationship comes, you can be more active in it, you can be healthier in it, you can have a wonderful relationship in it. And it's all about understanding yourself, understanding your body, and what's going on with you. So.
Well, you saw the thing. I'm definitely going to get it because I've got like the Annie Hall syndrome when it comes to to cunnilingus.
Good. So sign up. Sign up. And it's one of those things where, you know, for the next 30 days, because I want to reach at least 1,000 people. So for every person that signs up, they get one subscription free. So it's a 2-for-1 deal. So you get one and you give one to a friend. You just let me know who you want it to go to, and
so
your friend can get theirs free.
I can give one to my husband.
There you go.
Yeah,
and it's one of those things where I do tell people, you know, if you're in a relationship, get one for you, get one for your partner, because it comes every day in your email box. So isn't it a wonderful way to start
it already sounds good if it comes every day.
Yeah, it comes every day. You know, I mean, 365 days a year. You can't ask for more than that. You're so naughty. Really.
That's what I'm drinking. It's cocktails with Paulette.
It's cocktails, of course. So, yes, but it comes every day to your mailbox, and understanding that you might see the same email differently than your partner does. You know, I mean, it's the same thing, but the fact that, you know, you experience it in a different manner. And it's 365 days, so it doesn't matter, you know, if you signed up today or if you signed up for for January 1st, you're gonna start from the beginning. So you're gonna have 365 days of awesome love and sex tips, and it goes all over the place. Not all over the place. I mean, I cover everything under the sun here, from body to mind to spirituality to sexuality to all the naughty bits in between. So I want to go on to the next question. So the next question was, I have always been self-conscious about my lack of staying power. I have tried Kegel exercises, creams, pills, but nothing works for me. My wife assures me that I last long enough, but I want more control. Any new suggestions? And so I figure this individual has been getting suggestions from all over the place. Now, the piece that you talked about creams, you talked about pills, and I want to mention the pills. There are pills out there, you know, everybody knows about Viagra. You have, you have great staying power. A lot of younger guys are using Viagra, and when I say younger guys, I'm talking 20s and 30s that are using Viagra. That is the most dangerous thing you can do. Not only does it screw with your blood pressure, but the bad part is if you're taking Viagra or any kind of erectile dysfunction pills and you don't need them, you can actually make yourself impotent for the rest of your life, where your penis will not work.
Well, I don't know. I don't know where you stand on this, but what my psychiatrist has said is that he's seeing a rise in the need of, or the request for Viagra and Cialis and stuff like that.
Yes, because there's so many people watching porn where the guy lasts through the whole damn day, but they don't realize that, you know, the 30 minutes of porn that you watched where he was able to keep going with like 5 different women, you didn't realize that it took 2 days to film that, and in between they stopped, and in between they had the fluff girl, and in between, or the fluff guy if it's gay porn, and so you're having, you know, you're having 30 minutes of something that's like time lapse. You know,
if you've ever seen a time lapse. What my shrink says is that internet porn has been just one of the most horrible things on young men. You know, people try to talk about how porn is bad for women and all that, but my shrink says that it's actually bad for young men because it gives them, well, first of all, unrealistic expectations of what women want, and second, as far as staying power, and secondly,
it is that piece of, you know, you're needing to perform, and Matt Silver was talking about the fact that it's the idea that when porn starts becoming the sex therapy of the masses, which it has in a way, that's where you start having major dysfunction. And again, it's the fact that, you know, you think that, okay, here's, you know, like Ron Jeremy, you know, the ugliest guy there is, but he had all these girls that he was, that he was fucking. Now remember, he's getting paid to do this on camera,
Right.
and
Yeah.
so totally different than, him trying to be Mr. Average Joe and getting laid. So it goes back to the idea of staying power. And what is staying power? So is it, that you were able to last 30 minutes or an hour and you want to last longer? So when you're asking me, well, what else can I do? What other suggestions? It's getting into your body. And it's so important to understand what your body is going through. Staying power, if you're doing Tantra, if you're doing Taoism is even better than Tantra, I think. But it is learning how to put yourself on the pinnacle of anticipation, of holding it on lasting longer, because you're allowing yourself to take in every single aspect of sensuality from this moment. And like we talked about the question before about being able to be orgasmic by yourself but not with your partner, it's the fact that you're not in the moment anymore. You're not appreciating all the wonderful things that are happening, the touch, the smell, the breath on you. All of these things will allow you to be able to heighten your sensations. And then as you heighten them, you hold on to it and you make it last even more. We tend to be a society of shake and bake, and I tend to call it our shake and bake sex life. Where everybody wants to hurry up and gimme. I want my orgasm now. Why didn't I come? I didn't have it. It took me 20 minutes. Well, you know what? It should take you 20 minutes. It should take you an hour because you're experiencing it. If you want to have a quickie, then by all means have a quickie. But you know what? Quickies aren't like 2 minutes. Quickies take about 10 to 15 minutes. You're just hurrying up and doing it faster. So it is allowing yourself to experience the moment with as ever long or however long it takes. Now, if you're going into your partner and you're doing the penetration and you come and you're a minute man, then you have major issues here. And that's what you want to work on. You want to work on staying longer, on doing the Kegels, on, there's creams. Creams are just helping you to, get a little firmer, get a little tighter. Other things that you can try for making it last longer is getting cock rings. So this is, this staying longer is for a man, but it's a cock ring. It's called a cock ring. And basically
a cock ring.
Cock ring. C-O-C-K. Cock ring.
Okay.
And so there are different cock rings out there. There's the leather ones that snap on that, what you're doing is that you're putting it around the base of your penis to help contract, to help you have more blood flow to your penis. There's also the metal ones, and with the metal ones, you want to be measured with those. You want to make sure that you have the correct measurement because you don't want it to be so tight when you start out that it's restricting your flow, because as you get hard, it's going to, your body is going to expand, your penis is going to thicken, and so it's going to be too tight. So you want to get those measured. But cock rings are another way of being able to help you stay longer because you're stopping. I would say, doing some tease and denial would be another great way on learning how to last longer.
Yeah.
And the one thing that I see with guys is that they tend to have the give it to me now, and you have this a lot with younger men who are just learning to have sex, who are just, even for older men who are just getting back into having sex. And so it's that idea of if I don't get it now, I'm never going to get it. Or, oh my gosh, they're going to change their mind just as I'm ready to come. So I better hurry up and finish so that they don't change their mind halfway through. Because it's not uncommon, especially when you're starting out in a relationship, women will change their minds. Or if you say a stupid asinine thing, they're going to get upset with you and they're going to say, okay, well, it's over, let's stop. And so that builds that response on, I better hurry up and get it now before she changes her mind or gets upset or I do something wrong. And so at that point, I would say, one, ladies, stop doing that. Stop, you know, if it's an actual reason to change your mind, then change your mind, but don't use sex as a power play because that's not appropriate. The other piece is being able to relax and enjoy the moment and understanding that it doesn't have to be about penetration. You can be orgasmic without penetration. And if you start doing that, you will find yourself lasting longer because you're allowing yourself to get all the sensations out of the moment. It's kind of like, seize the day. Well, seize the sexual experience and allow yourself to get every little drop, squeeze it all out and get every little drop of that sexual experience that you can get. And that means feel how they feel against your body. How do they touch? How do they smell? How do they, when they breathe out, how does that feel? When they touch your hair, when they touch your body, when they touch your genitals, what if they don't touch your genitals? Then the anticipation builds up. So it's allowing yourself to have all those sensations and build them up to such an extent that you get to where you need it now. It's like you've been walking in a desert for 20 days and you definitely need the water now. And allowing yourself to build that up, oh my God, the orgasmic effect is like your head blowing off. It's literally, you fucked your brains out. And so that's the piece that you want to get to. I would say if the person has any other questions, contact me directly to talk about that because we can keep going on and on and on. And I want to get to some of the other questions before we end.
Well, the point that starts me is my wife assures me that I last long enough. And since I have 3 daughters, it's okay for me to say this because they won't know which one I'm talking about. But one of them has told me about having sexual experiences with guys, and they haven't come fast enough, and she's already gotten hers. And she has actually said, okay, would you hurry up? My God, hurry up and get on to me.
And get it over with.
Get it over with.
And that goes back to the guy is trying to hold on to make sure that he performs well.
Yeah, but
usually
he's thinking of some kind of abnormal expectation of how a male is supposed to perform to a female. But, those expectations, all of those websites and everything, like women love to drink cum out of champagne glasses and all that.
That's a total different topic. But that's the porn movie. That's your porn movie.
That's exactly right. But that's what the guys get into their heads. But my daughter has said, oh my gosh, she's like looking at her watch, would you hurry up already? Would you get off of me? And so I think that in certain situations, if his wife is comfortable and she's being honest, then maybe.
Yes, but and that's there's where I see a difference is, at times, and this is one of the questions that's coming up as well. But at times we tell our lover, oh, honey, it was wonderful. Don't worry. I loved it. I experienced it. And you're sitting there going, yawn, yawn, yawn. It was the worst sex you have had, but you don't want to hurt their feelings. And so in this part, where his wife is telling him, yes, honey, you're lasting long enough, for him, it's the feeling of inadequacy. And so how to assist you in having that. And if you're buying creams, if you're buying pills, if you're doing the Kegels and it's still not working, then for me, from a sexological perspective, I'm seeing that there's an issue there. And so it does become, sometimes men or women, they keep going, and they keep going. It comes down to communicate with your partner. And if you're not getting the release that you want, or your partner achieves orgasm and they're wanting you to hurry up and reach yours, then communicating. What do you need, honey, for me to help you achieve orgasm? What do you need, honey, for me to help you come? And that's what you end up talking. That's where you start building that comfort of being able to say, oh, it's okay. You can come now. The other piece, too, that I tell, especially for men, it's, and couples, not just men, but couples in particular, is understanding that unlike you see and read in a novel or see on TV, typically you don't come together. Yes, it can happen, and yes, it's wonderful when it does. However, typically one partner will go over and be orgasmic before the other partner. And so discussing, well, what's going to happen when you reach orgasm and I haven't? Do we continue? Do we stop? Do we take a break? Do we get toys? Do we, do you watch me play with myself until I come? Do you play with me until I come? And so understanding, what are you going to do after? So again, all about communication. What do you do if one partner does achieve orgasm and the other one doesn't? Is it okay that that happens? Is it something that happens all the time? Because if it happens all the time, then we have an issue. And so, again, going back to feeling comfortable, going back to, getting into the moment, feeling everything that's happening, and allowing yourself some tease and denial, working your way up to the point where you get fuel and you need it so bad because you want your partner and you want to be inside your partner, or you want to be orgasmic with your partner. And that's all about building your sexual desire. And it's
I
not
do
so
like
much
the idea of the
body,
whole
but it is
tease and
mental.
denial. That tease and I like that. Yeah.
Yeah, tease and denial, totally awesome. And it's one of those pieces where when you're using tease and denial, you're actually working on some BS stuff. So you're doing a power play in there. You're building anticipation, you're making them wait, and you're actually making it to where it becomes even more intense and more erotic and more, you get to where you desire your partner even more because of the fact that you've been denied. And one of the pieces that I was going to say before is that men tend to be, and I mentioned it, they tend to, I want it now, and they get really pissy if they don't get it now, if they get denied, if they have to wait and anticipate and so on. But actually what you end up having is you end up having an even greater orgasm when you have that tease and denial. And, putting them in chastity maybe might help. A man in chastity is always a beautiful thing to see. So this was, and I wanted to touch on this really quickly. This is one of the flyers that we have for BDSM Writers Con. And it's cute because some of the people like it and some don't. And we have one male or two females and one male flyer. And so it all depends on which one you want. And so I always see this one as, she's getting ready to come to the conference. So this is one of my favorite ones. And then the other one with the guy tied up is, I'm holding him captive at the conference. So I really like that one too. So, but here's the one question. I think we actually answered this one before. It's why are some men so interested in having anal sex? And so it's the fact that their prostate gland is in their anus, and the prostate gland for a man is their G-spot. So wouldn't you want somebody stimulating?
Okay, I do remember this came with one of my readers, but it was a female, and she was wondering why guys want to have anal sex with women. I can totally understand why men would want to have something stuck up their anus because of the prostate, which is the same as the G-spot. But I think that in this situation, it was why men want to have anal sex with women.
And if you're putting it from that perspective, why would men want to have anal sex with women? You're talking about the power exchange. You're talking about something that's taboo. You're talking about someone being able to take you in a vulnerable position. because anal sex is a vulnerable position. And so being able to allow your partner to take you in that form, for a woman to take a man in that way, that means that he must have a lot of confidence in the fact that you're going to still accept him afterwards. Also the fact that they're giving you, you know, so much of themselves, because a lot of the times we equate anal sex with masculinity, and we equate anal sex with whether or not, you know, you have some latent homosexual tendencies, which is not true. It's the fact that it's such a taboo issue, even for women to have anal sex. It's taboo. And so your partner, taking your partner anally from a woman to a man, that's a major power exchange. And that's, you know, that's something beautiful that you would exchange with your partner. It doesn't necessarily have to be all the time.
No, but I think this
is a way
man doing it to a woman. Why do men want to have anal sex with women?
It's sex. It's a part of, and I guess here is that you're going into a sociological question, or one of motivation. Why would you want to have sex, period? You know? So it is, you know, a lot of the times when you have anal sex, it is the taboo piece. It is the, you know, well, they told me I can't have it, so let me try it. Or isn't it wonderful that it feels great? You know, you feel a different tightness, you feel a different pressure, you feel a different sensation. And the same thing with men, you know, I mean, it's the one time that their partner is inside of them. I mean, how amazing is that? So if you're looking at it from a female perspective, do you like being penetrated? And if so, why? Because there's this amazing sensation, correct? And so you have your partner inside of you, feeling you, you know, you're feeling them, you're squeezing around them, you're taking them all in. So why is it that men aren't allowed to have that sensation as well?
Yeah,
to be able to experience the same exact thing.
As Colette, as a female, until I have a prostate, I don't want anyone going up that one-way street.
Until you have a what date?
Until I have a prostate.
A prostate? Oh, until you have a prostate. I'm sorry, I was totally hearing you wrong.
Yes, until I have a prostate.
That's a part of your own personal, that's your own personal preference.
Exactly,
And so it does become the understanding that, you know, it's your own personal preference. If you like it, do it. If you don't like it, don't do it. And if you like it and it hurts, then you're doing it wrong, so learn. There's some wonderful books out there. Actually, David's book, gosh, I'm spacing on David's book, but I will make sure that I put it, I'll send an email out with his book. But there was a book on, there's a couple of books out there on anal sex that are really great. And David wrote one that was for couples to, and I'm spacing on the name of his book and his full name, but he wrote one for couples on how to make it pleasurable, how to allow yourself to flow into it. And so I'll make sure that I give you the name of the book, and I was going to jump up and look in my bookcase because I have this enormous bookshelf or this enormous bookshelving of nothing but sexuality books. So if you ever want to get me a present, get me a sexuality book. But here's the difference. I want one that was written in the 1800s, 1700s, you know, anything before the 1900s.
Dr. Charley, if I were going to get you a sexuality book, it would be nothing but blank pages for you to fill up.
Oh, that's so sweet. I like that. That is like that's such a cool gift. Thank you. Yeah. That would be like my 365 days of love.
Oh, I'm looking forward to it. But I would like to I would like to find out the information on the book that you're referring to here.
I will definitely send it to you so that you can let people know. But like I said, I was going to jump up and just go to my bookcase, but I can't because I'm plugged into the computer and I'll totally lose everybody. But I will follow up on that. And so the last piece that I'm going to say about the anal sex is, you know, if you want to do it, do it. If you don't want to do it, don't do it. Some couples love it, some couples don't. Male to female, it's all about the power exchange and vulnerability and being that open with your partner. So totally different thrill. So enjoy the differentness. The piece on it too, I would say you need tons of lube. Definitely tons of lube. And use the silicone because it lasts longer and it's thicker, and that's what you want. I mean, your water-based lubricants dry up too quickly, especially for anal sex. So you want the silicone base that it'll last longer. Also, if you're talking about cleaning up, use a condom. But use a condom that doesn't have lubrication already on it. Use a plain condom so that you can use your own lube. And if you use a lubricated condom, then make sure it doesn't have any kind of spermicide. I don't think they're making the spermicide condoms anymore, but I'm sure they're out there. Because they'll just make you sick.
Oh my God, yes. Why would you put spermicide in that?
Yeah, and some people still do. So I mean, most of the condom companies, if I'm remembering it correctly, most of the condom companies aren't using spermicide anymore. Some of them still do, but that's just, spermicide is basically a really harsh detergent that you're putting into your body.
Right.
So you don't want to do that.
Yeah.
And if you go to my website, I actually talk about anal sex, and I put the link here, and it's bdsmwriterscon.com. If you go to the video section, there's a video on anal sex and avoiding pain during intercourse. Yeah. Yay! So it's an individual thing. If you like it, do it. If you don't like it, don't do it. And if you're not sure, then try it at least 3 times. So, and try different positions, try different, with the lights on, with the lights. I always tell people have sex with the lights on, because it's so beautiful to watch your partner, and it's one of those things where, especially if you're with your partner for the first time, you want to see their emotions, you want to see their face, you want to see their comfort with you. A lot of the times we have sex in the dark because of the fact that we're embarrassed about our bodies.
I like dim lighting, like a pink hue or something.
Yeah, you can use candles. I mean, that's a move.
Oh, candles are definitely.
But
so what is the best age? What is the age to start having sex?
What is the perfect age to start having sex? I would say when 14, you are definitely age of consent. I don't think you should be having sex at 14. It's funny because and my son used to get so pissed off at me about this, because I would say, okay, honey, you're not allowed to have sex until you're at least 16, 17. I'd rather that you wait till 17, but I understand if you're going to do it at 16. But I want you to wait till 17. And so our big joke became the part of, you can't have sex till you're 17. And so on his 16th birthday or something, I heard some of the kids say something about sex. And I'm like, Kyle's not allowed to have sex until he's 17. He goes, Mom, is oral sex considered sex? And I'm like, oh, please don't tell me you're doing that.
Oh, well, ask Bill Clinton.
Yeah, it's not sex. I wasn't sex and relationships are 2 different things. But, what's the proper age to start having sex? I would say at 14, you're too stupid to have sex. And you really don't understand. And we're no longer at the age of, in the society where the person's going to die in 30. So the only time that it was appropriate for a child of 12 to 14, 15 to have sex was the fact that their life expectancy was 30. So at 15, they were they were half of their life was gone, you know, but that's back in the 1800s. We don't have to do that anymore. And so, you know, the age of consent in the U.S. is age 16 to 17, so that the person isn't, you know, the person has a little more understanding of what's going on with them, what's going on in life. They actually understand how to protect themselves. And I think that's the biggest piece. If you're having sex, you're making a grown-up decision. And if you're not grown up, if you're not acting mature, if you're not protecting yourself from STDs, STIs, you know, sexually transmitted diseases and infections, or you're not protecting yourself or your partner against pregnancy, then you shouldn't be having sex, because you're just too stupid still.
One of my daughters calls children a sexually transmitted disease, but but yeah, I attempted to have sex when I was 14, but I was unsuccessful. But you know, the age of consent in California is 18. So
yeah,
it varies from
each place. Yes, each place is different.
Yeah.
Like in the South, you can get married at 17 if you have parental consent.
Sure.
You know, in some states, but it's, you know, and I mean, I talk horrible spanking for you, but the piece of it is, you know, and I joke about, you know, when you stop being stupid, then you can have sex. But some people are in their 40s and 50s and they're still stupid. So it's more as, you know, if and like I told my son, if you're gonna have sex, that means you're making a grown-up decision. And so if you're doing a grown-up decision, then act like a grown-up. Protect yourself, protect your partner. And that's the piece that you need to remember. And for me, you know, as a sexologist, I've done studies, and I'm actually doing African American men's sexuality study and a Latin men's sexuality study. And what I've seen from, you know, from the men's perspective on them talking about their first time having sex, you know, some of them, a couple of them have mentioned the fact that they had sex when they were 6 years old or 8 years old or 12 years old. And to me, that's somebody who has been abused. Because at 6, 8, and 12, you cannot make that decision for yourself. That's not a decision that you should be making. And if someone is asking you to have sex or having sex with you, then they're being inappropriate and they're actually abusing you. Men tend to turn around, you know, men tend to turn around and say, you know, this is a totally off topic here. They'll turn around and say, oh, well, you know, I was learning how to be a man. And that's not you learning how to be a man. That's you being abused. And so, you know, we would consider that abuse if it was happening to a girl child, you know. And so it's the same thing, you know. And as a clinical sexologist, I'm very adamant you shouldn't have sex until you're at least 16 or 17. You know, that's my personal belief and what I taught my son.
I see you've added to this, what is the appropriate age to stop having sex?
I'm sorry?
Well, down below that you have added, what is the appropriate age to stop having sex? And I'm going to say like 140 or something, right?
Well, I would say when you're dead.
Yeah,
you
exactly.
know, when you're dead, that's the appropriate time to stop having sex. You know, because you never stop being a sexual human being.
Right.
You were born a sexual human being. That's what you were born. And so there's nothing inappropriate with it. You know, we have this idea that, you know, we don't want to see mom and dad having sex. And, you know, when you look at, you know, grandma and grandpa, oh my God, they're having sex, you know, so what? So they're having sex, they're enjoying themselves, they're having a wonderful life. I actually had one patient, which, you know, if I am as, you know, as funky as her when I'm 82, I would love it. And I share this because she gave me permission to share. But, you know, she came into my office and she sat down and she goes, you know, I want to have sex. And I'm going, okay. And she goes, well, my boyfriend's not, not giving me as much sex as I want. He only wanted to have sex once a month. She wanted it once a week. And she was going out with a younger man. And I'm thinking, holy crap, you're 82, you're going out with a younger man. So I'm thinking, somebody in their 20s and 30s. And so she goes, yeah, and he's 65, 62, 65. And I'm going, okay then. So she's 20 years older, and she still has this vibrant, sexual appeal to her. I mean, when I saw her, I didn't even think she was that old. I thought she was in her 60s, but she carried herself very well, and she was still wanting to be and wanting to have a sexual life. And so, my suggestions to her were, I think you need a younger man. you need a younger man, or at least take 2 or 3. And of course, that was our joke back and forth. You should have 2 or 3 men to be able to satisfy you if your first one isn't satisfying you or not willing to satisfy you. So, what's the appropriate age to start having sex? When you're mature, and not just, well, I think I'm mature, but when you're actually behaving as a mature individual. And that's not until you're in your 20s, even then we're still immature. But, when you feel it's comfortable for you, and at least 16 to 17. And one of the reasons I say not before 16 to 17 is that at 14, 15, 16, your hormones are going ape, they're going ape shit. And you have so many hormones that are jumping into your head that you're not able to, to have a clear thinking. And then you become, like Romeo and Juliet, who are just, too dumb to live. So, so being appropriate and being mature about it. I wanted to talk about this one. This was because we're almost at our time here. And so I wanted to make sure that I address, or maybe we should just leave this till the next time we talk. And
if you're willing to,
well, I mean, naturally, of course I'm willing.
You've already shown. Let's go back to the decide really
matter. I like teasing. I'm a little sadistic.
Come
I
on.
like to tease you.
If you have,
there's still more. There's still more. Look at all those. Oh, here's my favorite picture. Isn't he gorgeous? I mean, he's just so yummy. So that's my favorite picture.
Okay.
See, so the men can come to BDSM Writers Con, and then I'll tie them up and keep them there.
Okay,
and we do have one of the workshops is on bondage. So that's a wonderful thing. But
you can never go wrong with a little light bondage.
No, and one of the things that I tell, one of the examples that I give to people when they ask me, well, I don't think I'm comfortable being tied up, but I want to try it. I say, well, get toilet paper. Tie your partner up, have your partner tied up with toilet paper. It's not just 1 or 2 strands, but, do a half a roll or so and tie them up that way. And here's the beauty of it, that you tell your partner, if you break free, I stop.
Listen, they have, I know that they do have cuffs that have Velcro on them, and it's so easy to break free from them.
Yes. There are some Velcro ones. I would say, but the thing is that if you can break, and here's the piece that you would throw in there. So you will do whatever you want to your partner's body and tease them and please them as much as you desire, okay? But if they break free, you stop doing all that teasing, all that awesome sex play. And you see them stay in the bondage. And that's the beauty of it. When they stay in the bondage, because they want you to continue instead of trying to break out. And then the other side of that coin is, well, if they do break out of it and because they can't stand it anymore and they need to grab you and, and
yes,
touch you and have sex with you, then, hey, awesome. either way you win. You win either way.
About the bondage, I would suggest that, personally, I'm not a sexologist like you, Dr. Charley, but personally, for someone who is considering bondage, I would suggest the Velcro cuffs, because that way, well, and especially if, like, somebody's going to bind you up and then, like, run to Taco Bell or something like that, obviously you need Velcro because you can't be left alone unless you can get out by yourself.
Well, you should never leave somebody that's tied up by themselves.
Exactly. Unless
that's like leaving a baby unprotected in the house.
Absolutely, exactly. Unless it's something like Velcro where they can free themselves or something like that. That's just common sense. But if someone is just thinking about it, I think Velcro is the way to go.
You're so funny. And there are actually, on my website, and I think it's up already, but on my website there are some toys, some bondage toys that you can purchase. That are blindfolds and little, the Velcro ones, but a little bit more intense, but you can bite your way through.
Right.
So it's, if you're looking for some fun, playful toys, DS toys, then by all means come to my website and take a look and purchase one or two.
Oh, absolutely.
Yeah, and we're going to have some, and beautiful stuff, we're going to have some at BDSM Writers Con, so we're going to have some for sale there as well. And so you can always, if you don't want it shipped to you immediately, you can order it now and just pick it up at the conference.
And I'm really looking forward to being there with Destiny Blaine and
Miranda Baker,
and
we actually just had Eden
Eden
Bradley just signed up. Eden, so she just signed up today. So she's coming in and joining us. And Joey W. Hill is our keynote speaker. I just love her.
Joey Hill? Yeah, I just absolutely love her. She and I have been on many panels together.
We did a panel last year together.
Her. Yeah, and Dusty Blaine is awesome, and everyone is interested.
And if you go to the website and you look under attending authors, you'll see the list of authors that will be attending, and also you'll see if you click on the author's name, you'll be taken to their web, not their website, but their blog. A lot of them have blogs with us and interviews that we've done with them. So you'll get that information. Plus, several of the authors are also providing workshops, which is what I love, because they're teaching how they became authors and some of the topics that other authors would want to know. But not only authors, but they're also giving out DS information that anybody would want to know. So you don't have to be an author to go to the authors track of BDSM Writers Con, because the authors are also giving out fantastic information about DS. And so you can go to either or. And there's going to be several live demos. I think we have like 10 live demonstrations, and a couple of them have to be done at the club. So we also have a club night. And so we're going to Fetish Tribe, New York City Fetish Tribe, is going to be hosting our night at the club. And Powder, who's hosting the event, is going to have so many wonderful events happening and play happening. But some of the demos, we have to do them at the club because for safety issues. Like we're going to have a fire demonstration, and we can't do that at the hotel. The hotel will not let us play with fire. So we're going to have it at the club itself. And Robert Ruppel, or Rumble, I will say his name wrong, R-U-B-E-L, is actually doing some fireplay for us. And I have one of the girls that I mentor on fireplay, Eve, Mistress Eve is going to be doing some fireplay as well. So you'll see it from a male perspective and a female perspective. And the beauty is that in fire, everyone connects to it in a different light. And so each person that's doing it, each person that's playing with the fire and putting it on the other person connects with it in a different way. And you'll see men in one way and you'll see women in another way. And some people are very sensual with their fire play, other people are very practical, and some are very playful. So it all depends. And I figure I will see if I can get Robert to come on and we can do a discussion on fire play in the coming weeks. But I'm going to be ending because we've been going for over an hour and a half now. But what I want to say is this is a live chat with Dr. Charley Ferrer and my guest Colette Saucier, and understanding that we will have these chats every week, every Monday. Guys have football, we have sex chats. So,
okay, well, just to correct you on a couple of things. Number one, yes. I have football. I love me some football. And also, and also it's Saucier. And
I always say that wrong because I'm not pronouncing it in the French way.
I know, yeah. But everyone needs to go and get my novella, Illusion's Possession.
Yeah,
and it is
because it got nominated for.
It was voted a top 10.
It was voted. It was nominated and voted.
Yeah, a top 10 of Reader's Choice of 2013, and it's a nice introduction to BDSM, and so everyone needs to.
And is it available in ebook as well as paperback?
Absolutely, you got it.
So for the first person that contacts us, we can give them a free copy.
Absolutely,
a free ebook copy. Okay.
Anyone who contacts Dr. Charley, I will send them an autographed copy of Alicia's Possession. And this summer, it will even be available as an audiobook. And
excellent.
Yeah, just in time for the BDSM Writers Con.
Excellent. So we'll have them for sale at the conference as well.
Yeah, definitely.
That's perfect. Perfect. So, okay, so I want to say good night to everyone, and I want to say thank you for joining us. And if it's not nighttime for you, because since this is being recorded, you can listen to it whenever you want. So feel free to contact me again at Dr. Charley at drcharley.com. And also, for those individuals that are interested, we have the 365 days of love and sex tips. So feel free to connect with that, less than $5. You get it sent to your email every single day. You get an email from me. And also, if you're interested in other services, please feel free to contact me. I do mentorship on dominance and submission, as well as mentorship for your relationship. And if you're interested in getting more information about the Writers Con, please see BDSM Writers Con. It's going to be August 21st through 24th in New York City. And this is our third year having it in New York City. The weather is actually wonderful at that time of the month. You know, people say, oh, it's too hot in New York City in August, but the last 3 years, every year actually, has been wonderful, right at, you know, it knows that it shouldn't mess with you. I'll whip it into shape. But thank you all for joining me, and this is Dr. Charley Ferrer, and you have a wonderful day and live with passion.